Hey guys, welcome to episode 5 of our anxiety video series. Today we're going to learn about COVID-related anxiety in children. Today we have our guest speaker, Dr. Ashima Srivastava. She is a clinical psychologist in Max Hospital in New Delhi. So let's ask the first question. Can you please elaborate on what COVID-related anxiety is in children?
Yeah, so talking about COVID-related anxiety, as we all know that this is a time which is associated with lots of uncertainty, and during the current pandemic, all of us are being affected by it in different forms, and probably in many families, children have also been affected, wherein they have tried to exhibit lots of they tend to exhibit lot of features of anxiety and disturbed emotional state, which could be characterized in the form of reassurance seeking behavior. The physical symptoms could also be evident, like constant, reporting of headache or stomach ache, which has no uh, physiological basis. So these are certain features which are commonly present in children out of the current scenario due to the current COVID related issues. So,
What are some tips that you can give us on handling children with these anxieties?
yes, there are certain tips which can be quite helpful for handling COVID related anxiety among children and adolescents. The first could be it's very important that we keep a routine, sticking to a routine for sleep, meal times, exercise, and work can help manage a lot of stress. Apart from that, getting a good night's sleep, limiting your caffeine intake, alcohol and nicotine intake, creating a bedtime routine, and finding a relaxing activity like reading or journaling or listening to quiet music to slow your brain down before the bedtime. So that can all be quite helpful, and seeking social support at appropriate time whenever you feel apprehension or fearful. Staying connected with your loved ones can help you feel less lonely, so that's very important. Schedule your worry time. Take 30 minutes to identify what's bothering you and what you can do about it. So have your worry session allocated at the same time every day. Do not dwell on what if scenario. Focus on what actually makes you feel anxious and what actually you can change. Move your body by involving in exercise regularly. That is important part of physical and mental health. It can ease your feelings of anxiety and boost your sense of well-being.
Okay, thank you for these great tips. So this is how children can help deal with anxiety, but how can parents notice red flags for anxiety that are found in children and adolescents?
So there could be various red flags which could be, elicited in children. Like its parents can look for if the child is having frequent tantrums or intensely irritable much of the time, or if he's often talking about fears, constantly about worries and poor concentration, complain about frequent, stomach aches or headaches with no medical cause or physiological basis, and are also in constant motion and cannot sit quietly. They seem to be very fidgety, sleep too much or either too little, have frequent nightmares, are not interested in playing with other children and difficulty making friends, struggle academically and have experienced a recent decline in grades. So these are certain red flags which parents can look to in eliciting whether the child is undergoing any type of anxiety.
So, how can parents help in managing fears and anxieties in children and adolescents?
As we all know that parents, they work as good, they represent themselves as good uh, role models for their kids. So witnessing a parent in a state of anxiety can be more than just momentarily unsettling for your child. So kids look to their parents for information about how to interpret ambiguous situations. If a parent seems consistently anxious and fearful, the child will determine that a variety of scenarios prevailing currently are unsafe. So there is a good evidence that children of anxious parents are more likely to exhibit anxiety themselves, and a probable combination of genetic factors also. It can be quite painful to think that despite your best intentions, you may find yourself transmitting your own stress to your child. So, when you are feeling anxious, you tend to start worrying about what might happen in the future. All those what if scenarios start prevailing in your mind. So, to avoid getting caught up in those worries about the future, it's very important that you try to practice certain mindfulness based exercises, which is a technique of focusing on the present that can be quite helpful to uh, deal with your own anxiety as a parent. So, this way you will be able to prevent exhibiting anxious behavior in front of the child. Parents can also use a traffic light, chart to help kids share how intense their feeling is. A red light would mean that they feel overwhelmed. A yellow light would mean that the anxiety is medium, and a green light would mean it's okay with them and they are not anxious anymore. So instead of asking how was your day, which is pretty vague, maybe parent could ask their child, did your anxiety get in the way of you having a good day today? This can be, a good way to put forward a query to your child just to ensure how was his daily routine without anxiety.
Thank you so much for helping us learn more about COVID-related anxiety. As we know, it's a huge problem in today's world because of the pandemic, and a lot of people are suffering from it. And we hope that we can help educate people about the dangers of anxiety related to COVID and how to cope with it. As Dr. Srivastava said, mindfulness can be an important tool in helping manage anxiety, and we will learn more about mindfulness in our next video. Thank you.
Thank you. If you enjoyed this video and want to hear from us again, please like, subscribe, and hit the little bell icon to get a notification when we drop our next video.